Hello, my name is Simina Bîle and I'm a third-year student at Cluj School of Public Health, Cluj-Napoca, Romania. Now I'm going to present to you a systematic review that tackles the relation between the intake of sugar-sweetened beverages and the weight gain. Weight gain became a significant public health problem, especially over the last few decades. Worldwide, 3.4 million people die each year as a consequence of being overweight or obese. Moreover, overweight is associated with 44% of the diabetes burden, 23% of the ischemic heart diseases, and between 7% and 41% of the cancer burden. Recently, sugar-sweetened beverages have been at the forefront of obesity-related policy debates, as their consumption was positively associated with increased body weight and risk of obesity, and negatively associated with the intake of important micronutrients. Many studies analyze the relation between the intake of these beverages and weight gain, but it is difficult to say if a direct link exists between them. In this respect, building on the available literature published so far, the present systematic review aims at providing an overview of the relation between the intake of sugar-sweetened beverages and weight gain. The systematic review focused on the scientific literature dedicated to the consumption of sugar-sweetened beverages and their influence on weight gain. The research was performed by using only one database, namely PubMed. The articles that were included in the review had to be written in English, published in scientific journals, and they were chosen regardless of their publication date. Then, after the initial research, I included the results into the reference manager called Mendeley and scanned the articles by their titles and abstracts in order to test if they are relevant and if they fit with the main objective. Following the literature review, 110 articles were found initially, and out of them 49 articles were selected, and the further analysis was based exclusively on them. In this respect, the intake of sugar-sweetened beverages was associated with several health-related problems such as weight gain and the total and abdominal obesity. The consumption of sugar-sweetened beverages has negative effects on both children and adults, regardless of their residence setting, or this varies by certain behavioral and social demographic characteristics. In this respect, a study developed on the US adults revealed that it is more prevalent among younger adults, males, non-Hispanic blacks, adults with lower education or low income, adults with missing income data, who are physically inactive or who are current smokers. These data support recommendations to limit liquid calorie intake and to reduce the sugar-sweetened beverages consumption as a means to avoid weight gain or obesity. But although many studies support the hypothesis that sugar-sweetened beverages cause weight gain or obesity, there are several studies that found no association between these two variables and that have left this issue open to debate. One limitation of the study is the language, as I was able to scan only the literature that was published in articles written in English. Furthermore, another limitation is represented by the fact that I had access only to the study's abstract, and I was not able to read the full version of each relevant article. Also, essential information about the influence of sugar-sweetened beverages on the weight gain might have been skipped by using only one database. To conclude, given the concerns regarding the intake of sugar-sweetened beverages and the related disease burden, but also given that the worldwide incidence rates of overweight and obesity are rising, it is needed that the current public health interventions to include education about beverage intake. Also, further research it is needed to monitor the sugar-sweetened beverages consumption patterns and the individual level association with such consumption. So that was all. Thank you for your attention. And if you have any questions, I will gladly answer to them.